What's going on, everyone? Happy Saturday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. It is time now for the Saturday edition of the Pandemic Update for Saturday, August 5th, 2023. Taking a look today at India. India added another 77 cases. Yet another day where we're seeing their cases trend on the, higher, a little higher than what they have been. Remember, we saw a lot of days that were in the 40s and 30s. Now we're seeing more days that are above 50 again, and I suspect if this continues, we'll see a few days where they report over 100 cases once a day. Now you're saying, data report, there's a billion people that live in India. That's not that big of a number. No, it's not that big of a number, but it's an increasing number, and it's a number that we know is undercounted. And they have 1,553 active cases, and their deaths are at 531,918. All right, now taking a look at this. This is something that I found via Twitter, and this is really interesting. Wales COVID sewage testing ends as funding is axed. So at a time when we need to see more sewage, wastewater, the wastewater videos that we do on Sundays, those wastewater sites that we show you during the week, at a time when we need to see more of that, unfortunately, over in the UK, in Wales, there's not enough funding to keep it going. So this is a bad thing that we do not like to see at all, especially when we know testing is really low right now. So this is not a good thing to see at all. All right, this is from Breaking Bad. If anyone ever watched the show Breaking Bad, unfortunately, Mark Margolis has died at 83 years old, and he was also on Better Call Saul, and I believe he was actually from my area in Philadelphia. He was actually from Philadelphia originally, so yes, he died after suffering, I believe they're calling it some sort of an illness. It's another sudden death. We've seen a lot of sudden deaths lately. Maybe someone ought to do some research as to why these sudden deaths are just so high right now. We're seeing so many celebrities in sudden profile figures get either a sudden illness or a sudden death or go into sudden illness and then unexpectedly die. Remember this past week? We saw the lieutenant governor of New Jersey pass away? Yeah. I mean, it's getting a little interesting as to why this just keeps happening. All right, we did get some numbers out of Florida yesterday. Florida reported another 15,170 new COVID cases this week, an increase of 52%. And this is in Florida, the heavily rate Republican state where people do not like to get tested. So, yes, my friends, this is very concerning to see. And it also does not include those at-home tests. So, yeah, Florida, the cases are rising. And look here. Here's the kind of response that you see. Nobody cares. Who cares? Stop. You can't. Stop the madness. Stop the paranoia. All that stuff. The fear mongering. No, it's not fear mongering. Cases result in potential deaths, hospitalization, and long COVID. If we know 30% get long COVID, that's thousands of new people getting long COVID that could potentially be disabled. And within that 30%, there's an X number of people that don't even know that the new problems that they have are because they had a COVID infection. It's just totally ridiculous. So if you take 30% from each wave of COVID, guess what? That number is going to keep going higher and higher. We know it's in the millions right now. 5 years from now, could we have over 100 million people in the United States with long COVID if we continue to let this rip? Yeah, it's possible. And I'm seeing people now, like, remember Akish Jha, Dr. Jha? He's saying, we need to do something about long COVID. And then, well, let's just continue on here. I actually Google search long COVID. This is one of the searches I usually do. And I always thought maybe I'd find another story to share here. I see a bunch of things that just, I don't know, make me kind of upset. It says, we can't ignore long COVID, Dr. Jha says. Then there's another one down here. Doctor explains long COVID symptoms and prevention. Okay, let's put that article together with this article. So he's saying we can't ignore long COVID and we need to prevent it. Okay, both of those can be done with just one simple thing. Get the number of infections under control and stop there from being COVID waves. Get people to go back to mask again. If we could just did this simple little measure, masking, just a simple measure. It's safe, It's effective, and it can prevent COVID cases. If we can prevent COVID cases, then we are preventing long COVID, because COVID cases equal potential new long COVID people. That's the only way we are going to stop this. We don't have a treatment right now that prevents cases. Yes, the vaccine can prevent severe cases. Yes, the vaccine can prevent death. But unfortunately, the vaccine is not very good. It can prevent some infections, but it doesn't prevent all infections. And the most effective tool we have is mask. If people would just wear a mask in public places, I know I'm preaching to the choir at this point, but that's how you stop or slow down infections, and that's how you slow down the number of new people getting long COVID. Because right now, the number of new people getting long COVID, as there is an ongoing summer surge, is increasing. We're watching it go upward, because every time you have a wave, the rate of people getting long COVID is going up faster, because 30% of those people in the new surge will end up with long COVID, and that's more people that need medical attention. That's more people that's going to clog up the health care system. All right, something else very important that we have to talk about today. Kind of unexpected to me. Maybe I should have known about it, as my main hobby is weather forecasting, but it is what it is. Here we go again. Look at this wildfire smoke that is coming in from Canada. It's coming down. And yes, it's in the Mid-Atlantic too. If I step outside, I was outside earlier. I did a few deliveries at breakfast. Probably going to do some more at dinner time. Although maybe not. Maybe not, because the air outside, when you walk outside, it just smells super smoky. It doesn't even smell nice. It was supposed to be a nice day here in the Mid-Atlantic. The humidity was supposed to clear, and now we just have this dark cloud of wildfire smoke over us. I mean, you can't even see blue sky today, and this stretches all the way back to the Dakotas. So anyone within this area right here, which I am circling, please use extreme caution if going out today. It's going to be harder to breathe. The air quality is bad, and unfortunately, that's not the only area. Look at the West Coast. We're seeing more yellow pop up. Look from Washington on up to near Vancouver, up into Canada. Yes, look at these reds. That is some really poor air quality. So please be extremely careful in these areas. Don't overdo it. Take it easy today. I mean, even if your humidity is not bad, you have to deal with this wildfire smoke, which is bad. If you want to learn more about the weather and climate, yes, sometimes I do mention how it affects our health on my climate channel. I got another channel, at Climate Data Report. I probably will be doing a weather update directly following this video when it gets released. We do have a couple things to talk about there today. Taking a look at Walgreens national positivity, it's up to 42%. Look at the chart. It keeps going up. This is not good to see. Taking a look at wastewater here, you can see wastewater is continuing to rise across the country. That little drop in the south, don't pay any attention to that. You just saw Florida, the cases are continuing to go up, so we're not buying this wastewater. It'll probably continue its trend upward next week. Speaking of that, we will have our weekly wastewater update video tomorrow. Now we're going to take a look at a few of those sites that show other things, not just wastewater, not just COVID, but flu, RSV, norovirus. And let's come down here to Memphis, Tennessee. Hopefully we can see a couple of them. Sometimes this page freezes up on me, and I don't know why, but look at this. Memphis, Tennessee. This is a brand new site, so this is the first reading. And COVID, it's there. There's actually a moderate level being detected. Influenza is not being detected. RSV is not being detected. HMPV is not being detected. No detection of Mpox and norovirus. The levels here, the value, 6,031. So that's actually a little higher than some of the other sites. Again, this is the first time we have seen this site come online. And that's the second new site I've seen this week. So this is good. I hope to see this map fill in. This is fantastic. So we were talking about Florida just a little bit ago. What do you say we take a look at a site in Florida? Whoa, Orange County, Florida. Look at the COVID rising here. And this is as of August 5th. This is as of today. Yes, this site updated on a Saturday. To the people at Wastewater Scan, you guys are fantastic. You guys rock. You even update your data on a Saturday at this late in the ball game. Thank you. God bless you. Influenza, not an issue today. There was a little RSV concern here back in July, so that's interesting to see. HMPV, not an issue. Mpox, not an issue. Norovirus, whoa, this is actually all suddenly starting to go straight up, and it looks like it's over 10,000 at this point, so that's interesting to see. Let's do one more site, shall we? Why not? I mean, they're updating their sites on a Saturday. Well, look at all these sites in California. Are these new sites up near Oakland? Some of these got to be new sites, right? I don't recall seeing this many sites. Okay, Oakland, as of August 5th, today. Oakland has dropped a little bit. Influenza is not an issue. RSV, there was a little RSV issue just not too long ago. HMPV is not an issue. Then Mpox, not an issue, and norovirus is down. Alrighty, that does it for wastewater scan. We'll probably incorporate some of this into the full wastewater update tomorrow. For example, last week we had to do Boston because on the CDC site, a lot of those sites don't update all that frequently, and who knows? Maybe eventually we'll just do a full video on this data right here. Although I do like incorporating anywhere between 2 to 4 of these sites a day into the daily pandemic update. I think it just works better, and it proves that, hey, we do talk about flu too. Because I love when I get those lovely little comments and say, yawn, take a look at flu numbers or anything in relation to flu. And I'm like, okay, I'll show you the flu. Right now, flu's not a big issue. And I'm going to show you the flu again at the end of this video. All right, moving on now to some CDC numbers. Here's the new number of sites, various different colors. Orange and red are high. We'll focus on this more tomorrow. And yeah, there's a lot more orange and red sites. We'll look at all that tomorrow during the wastewater update. Emergency department visits. This map just looks terrible. It's atrocious. Anything in a dark orange is a substantial rise in emergency department visits. Yeah, isn't that awful? There's quite a few countries, quite a few states. Pennsylvania, my state, that's one of them. Any of the ones in the yellow are stable. Any of the ones that are in the greenish blue color, greenish color, we'll say, it's a moderate decrease, and there's only one of them. It's Rhode Island, and there's 4 states that did not report, which one of them includes Puerto Rico. We'll take a look at Puerto Rico numbers very shortly. And now moving on to the latest variants. We have to update this to show the national. Here we go. EG.5 is at 17.3%, but the other one I'm now watching, and I don't think I see enough people paying attention to this. The FL1.5.1 variant is now at 8.6%. That is surprising us. That variant's coming up a little bit faster. Why is it surprising us? Because when we go down to Region 2, which includes New York City, Puerto Rico, Virgin Islands, New Jersey, I tweeted out yesterday saying, you know what? It doesn't make any sense to me why Puerto Rico and the Virgin Islands are included in New Jersey and New York. Simply for this reason. FL 1.5.1 dominates there. Is it because of something going on in New York and New Jersey? Or is it because of something going on far, far away in Puerto Rico and the Virgin Islands? I honestly can't answer that question. But, again, this variant is sneaking up there. It's the dominating variant there at 20.7%. So it's definitely something we're going to have to watch. All right, moving on. Something else we need to watch. New Jersey. Hospitalizations are up today. 267 reported in New Jersey today. 68 out of 70 hospitals reporting. 8 people are on a ventilator. In the ICU, that's now up to 29. Discharges, 37 people are discharged. And for those who want to comment and say, yawn, there were X number of hospitalizations in 2020. Okay, maybe there were. But again, this number's going up, and again, it represents that cases are definitely rising. And like I said earlier in the video, 30% of all infections do go on to develop long COVID. So that's pretty serious, and it's something we need to keep an eye on. I was hoping to show you this today, Philadelphia's EMS numbers, and it's still not out. They're delayed in showing it today. When it's out later on today, if it does come out, I'll retweet it. I tend to retweet it every day. Let's take a live look in at what's going on in the Philadelphia suburbs. Montgomery County, there's 11 calls right now. Not terribly busy. I do see cardiac arrest. That's never good to see. Respiratory emergency, accidents, fall victims. The usual stuff. Taking a look at Chester County, also not all that busy right now. We have sick person overdose, some falls, diabetic emergencies, a couple of them. That's never good to see. Moving on to New York State. I'm going to move myself back to the right. No update out of New York State today. They don't update on the weekends. 1,237 new COVID cases reported yesterday. Positivity is now at 11.8%. The 7-day average is at 10.7%. Let's take a look at New York State hospitalizations. First off, New York City, which did not update today. 294 people in hospital, 28 people in the ICU. And on a statewide level in New York State, I'm going to zoom this in for you. You do see that New York State, yeah, it's higher than any point from the previous week. We'll have to see if this continues next week. 648 people in the hospital, 61 people in the ICU. We know Texas rose this week. Texas had 9,326 cases this week. And now taking a look at Puerto Rico. Puerto Rico had 832 new cases on the most recent update. 162 people in hospital. That hospitalization number did go up. And they added 8 deaths today and 8 deaths on the previous report. They did fix that glitch which showed thousands of new deaths, which we knew that was wrong. All right, taking a look at the international update. There's just a couple things I want to show you here. Around the world, 56% decrease in cases, 52% decrease in deaths. Italy is seeing an 18% increase in cases now and a 71% increase in deaths. Italy is well underway into a new wave, a new surge. The point being, cases and deaths are rising there again. Not good to see. And Ireland, whoa, look at this. 249% increase in cases in Ireland, 422 versus 121. 33% increase in deaths, 84 versus 16. Chile, 35% increase in cases now. Belgium, 82% increase in cases now. So yes, my friends, the cases are definitely going up in some places. That does it for the international update. And real quickly, let's take a look at this. This is the flu charts across the United States from the CDC. Minimal flu across all regions of the United States. Minimal being the lowest level. You got minimal, low, moderate, high, and very high, which was just added last year. And look at that. It's minimal everywhere. Probably within the next month or two, we will start to see some coloring go up. I suspect we're going to see an early surge in flu, RSV, COVID. Another one of those triple demics again, or triple pandemics. It's going to happen again like we saw last year. I think fall, it's going to be a rough period in fall. The hospitals are going to get a burden of a lot of different illnesses. Alrighty, folks, that does it for today's pandemic update. You can always follow me on Twitter at COVID Data Report down below. I'm always constantly tweeting stuff out there. I probably do about 20 to 25 tweets a day, sometimes less, sometimes a lot more. I think I've already tweeted about 10 different things today. So follow me there for my latest updates. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. And if you know anyone that needs a reminder that, hey, the pandemic is not over. You saw Florida. You saw some wastewater sites that are rising. By all means, share this with them. Give them a wake-up call. Share the information that you just learned today. And say, hey, I was watching this channel on YouTube called Data Report. And, they were saying our area was pretty bad right now. Maybe we should scale things back. Maybe we should take some precautions. Maybe we should go back to masking. By all means, spread the wealth, spread the information. I will see you all again next time. But until I see you again next time, stay safe, everyone, and have a great Saturday afternoon. See you all again tomorrow.